Pranam. Today at Focus on Health, we are honored to have one of the esteemed orthopedicians of our country with more than 2 decades of experience and conducted approximately 3,000 surgeries, spine, trauma, joint replacement, ligament reconstruction and deformity correction. And he is the head of the department of IMS SUM Hospital and the founder of one of the well-known clinic, orthopedic clinic of Bhubaneswar, the Max Knee Clinic. Please welcome Dr. Aniruddh Dash. You must be knowing that currently India is the diabetes capital. But do you know by the year 2025, India is going to be the arthritis capital, which is indeed an alarming situation. So let us know from Dr. Aniruddh Dash what is this arthritis and what are the causes and how we can ward off this threat. Welcome sir to our show and to our channel Focus on Health. Sir, as you know, by the year 2025, we are going to be the arthritis capital. So sir, we'd like to hear from you, what is this arthritis? What are the types of arthritis and what is the most common form of arthritis?
Basically, arthritis is a painful condition of the joint characterized by inflammation and stiffness. So there could be many causes for arthritis. The most common is osteoarthritis, which involves the joint, its synovium and the soft tissue around the joints. So when we develop degeneration of the joints, that can lead to arthritis, and degeneration can be because of many causes. That may be due to metabolic causes, any local pathology. So this can lead to arthritis, and there are various types of arthritis, and the arthritis also progresses to various stages. So we can divide arthritis into early and mid-range as well as advanced arthritis.
What are the risk factors for arthritis?
Just like any other disease, osteoarthritis also has various risk factors. These risk factors can be genetic, metabolic as well as local risk factors. In genetic, it can be hereditary, and in traumatic and other risk factors can also be there because it is a joint, it's a moving area. So whenever there is a degeneration or excessive use, that can also lead to osteoarthritis. So we should know about the basic causes and the predisposing factors. Even dietary disturbances can also lead to osteoarthritis. People with common predisposing factors like diabetes, hypothyroid and other communicable diseases, that they can also develop osteoarthritis. Obesity is also a major factor for osteoarthritis because all of the weight of the body is transferred to the joints. So when these joints are degenerative, the burden of the osteoarthritis increases because the patient is overweight.
Like you told, osteoarthritis is the most common form of arthritis. So we would like to hear from you, what are the treatment modalities of osteoarthritis?
Once a patient has some predisposing factors of osteoarthritis, he should take certain precautions, like he should avoid unnecessary stress to the joints, dietary modifications, rule out the exact cause of the predisposing factors, and have some modifying physical activities which can lead to less overload over the joints.
So is this osteoarthritis curable?
Since arthritis is a degenerative disease, a patient can be cured up to some extent. He cannot be cured fully because once the disease process is progressing, then it can lead to other metabolic causes, which are the predisposing factors that can lead to crippling effects. So early diagnosis, proper management and proper following the consultation of the doctors, that can lead to lessening of the burden of the osteoarthritis. Once a patient has been stamped and diagnosed as osteoarthritis, he has to go through a proper rehabilitation program. He needs to have a proper exercise, he needs to consult a doctor, he may need to consult a physical therapist, he needs some medications, and finally if all these fail, then he might undergo surgery which can correct the alignment as well as the structure of the joints, which is also known as joint replacement surgery.
So from the risk factors that you just mentioned, I came to know that actually I am prone to suffer from osteoarthritis. So sir, in this condition, can I think that with osteoarthritis, it's a life-threatening condition for me, or can I have permanent disability from osteoarthritis?
It is quite possible that a person with arthritis may land in some disability. That can occur if he has been diagnosed late, or he has been under inadequate treatment, or he has not followed the proper prescription and advice of the concerned doctor. So that can lead to a crippling effect and he may be disabled for life. If you get osteoarthritis, nothing to worry. Orthopedicians are here. We are here to treat and diagnose your disease. And in this digital world, it is now an open world. The world is a small place now. You can reach up to your doctor very easily, take consultations online even if you are not able to visit your doctor physically, and get treated adequately, and so we can prevent a gloomy osteoarthritic future in our country.
So thank you very much for your insights on osteoarthritis, and I'm pretty confident that our viewers will definitely get benefit from this, and they will try to implement all the steps that you have told what of this osteoarthritis and what are the preventive steps, what are the treatment modalities they need to take. I'm pretty confident that they will definitely take, and I must say that all of you, early detection is the key. So whenever you think that you have some symptoms of osteoarthritis, do visit your orthopedician and get treated early.